How does the spread of prevention methods reduce the chances of teenage pregnancy and ensure safety during early sexual intercourse? Teenage pregnancies are all pregnancies before adulthood. According to World Health Organization data for 2019, the number of pregnancies among 15 to 19 years old worldwide totaled to 1 million cases, with 60% of pregnancies being unwanted and 40% of girls still having a baby. In Kazakhstan, teenage pregnancies have increased by 55% over the past 7 years, and doctors have attended more than 5,200 such births. However, despite the increased pregnancy rate, cases of termination of pregnancy remained at 1,100 to 1,300 abortions. The largest number of pregnancies occur in the south of the country, namely in Mangistau, Turkestan, and Jambul regions. The cases of early pregnancies are negligent attitude to contraception, violence, sedations, and psychological problems. For example, in 2022, 719 cases of violence were recorded in Kazakhstan, given the fact that most of them are silent. UN 2023 states that Alaskan mothers 10 between 90 years old are at higher risk of eclampsia, postpartum endometriosis, and systemic infections than women 24 years old, and their babies are more likely to have low birth weights, be born prematurely, and suffer severe neonatal morbidity. Early pregnancy can cause significant damage to the reproductive health of Alaskans, including negative effects on their eggs and overall brain function. In young girls, their reproductive system may not be fully developed, which leads to a decrease in egg quality and increased risk of chromosomal abnormalities. Hormonal changes caused by pregnancy can disrupt the normal egg maturation cycle and lead to premature aging of the ovaries, which reduces future fertility. The high risk of complications such as preeclampsia and anemia negatively affects ovarian health. The psychological tension and social consequences of early pregnancy can exacerbate reproductive problems and create additional obstacles to the normal functioning of the reproductive system. Solutions to the problem of teenage pregnancy proposed by the UN include sexual health education, access to contraceptives, and training in their proper use, as well as social programs. So this is what has to happen in order for sexual encounter to result in pregnancy. In order to reach one of the two fallopian tubes, the sperm must travel up the vagina via the cervical opening and upwards through the uterus. One sperm has an opportunity to fertilize an egg if it is in the tube after being discharged during that month's ovulation. The purpose of contraceptives is to stop this process, and they work in the three basic ways. They block the sperm with condoms. Second is disabled sperm before they reach the uterus with spermicides or suppress ovulation. Now let's talk about the third category. The method by which contraceptives prevent pregnancy is by inhibiting the ovary's ability to mature an egg. So it's natural for sperm to fertilize if there isn't an egg in the fallopian tube. The pill, the patch, the DEPA injection, and the vaginal ring are examples of hormonal contraceptives that release synthetic forms of different progesterone and estrogen combinations. These hormone combinations prevent ovulation, allowing the developing egg to remain securely inside the ovary. Additionally, synthetic progesterone is equipped with a block trick. This thickens cervical mucus, making it difficult for sperm to pass through it. Other methods of contraception combine main techniques into one. For instance, a lot of intrauterine safe devices or IUDs include artificial hormones that prevent ovulation. Some also contain copper, which disables sperm while also making egg implantation in the uterus difficult. Now let's focus on the economic factor. First advantage is that contraceptives can be more economical in the long run compared to the cost associated with unintended pregnancies, including medical expenses, loss opportunities for education and employment, and social welfare programs. Second is empowerment. Access to affordable contraceptives enables individuals to plan their pregnancies according to their economic circumstances, contributing to financial stability. And however, it also has disadvantages. For example, economic barriers such as high costs or lack of insurance coverage can limit access to contraceptives for low-income individuals or those living in underserved communities. Some contraceptives could have a price approximately 10,000 tenge, which could be very expensive for some people. In conclusion, teenage pregnancy is one of the very relevant problems in nowadays. As we already said, many people suffer from its consequences. Therefore, it's really significant to solve it. And one of the main and best solutions is usage of contraceptives. However, before using it, we should consider the economical advantages and disadvantages of the solution, so that you will be ready to do it. So thank you for watching the video and goodbye.